And it is okay to clap for him. This is awesome.
Thank you. Slide this on. Can everybody hear me okay? Get it down there? Okay. So I am Evan Werk. I work over at the Banner Concussion Center. I'm really lucky because I get to work, much like Dr. Cardenas, with a host of specialists in concussion care and management. I work with other physicians. We also have neuropsychology on staff. We have physical therapists that work with patients on balance and recovery of balance after a mild traumatic brain injury, as well as neuropsychology and neurooptometry to help with, again, those different domains and different symptoms that patients often experience with concussion. So I'm going to talk a little bit today specifically about diagnosis. You've already heard from Dr. Lifshitz and Dr. Cardenas about what concussion is and the different domains that patients have symptoms in. So I'm going to work through just briefly how we go about diagnosing concussion. So as you already heard, concussion is a functional disturbance in the way that the cells within the brain communicate with each other, right? So it's mostly a functional injury, as opposed to more severe brain injury, which is usually more of a structural injury that you can see on imaging. So part of the diagnostic conundrum with concussion is that there's not a lot that you can see, right? The objective data is difficult to come up with. So that's what we really need to try and do. So to start, I'm going to talk about a few myths that still persist around concussion. So first of all, some people still think that you have to be knocked out to have a concussion, right? And that's not true. You can have less severe mechanical force that doesn't result in loss of consciousness and still experience symptoms of concussion. A lot of people think that you have to have a direct blow to the head, right? And that is a very common cause of concussion, but we also see many people who come in from a motor vehicle accident, never striking their head as a restrained driver, that have had a whiplash type of injury, right? Because that has a similar mechanical force, so even though they don't hit their head, the brain moves within the skull and is able to be injured as a result. Imaging. You don't necessarily have to have imaging to detect concussion, right? We said that this is more of a functional injury than a structural injury. So most of the time, if you get imaging on patients with concussion, also known as mild traumatic brain injury, the imaging is going to be normal, especially like a CT that they may get in the emergency department. So that presents a diagnostic challenge, right? We like to be able to see things and say that, yes, this looks like concussion, therefore we have a concussion. Also, time for resolution is a little bit of a myth still that, there's a set time that people recover from concussion. And we're finding, as we get more and more information and we watch patients for longer, that people really have variable times of recovery depending on risk factors going into their injury, severity of symptoms at the start of their injury, etc. And then finally, there's a little bit of a myth that's a little new that there is a test that can diagnose concussion. Now when I say this, I'm being pretty specific in kind of these headlines that you may have seen recently, right, earlier this year, that there's a new blood test out there approved by the FDA that diagnoses concussion. Now, this test is useful in a certain respect, right? So the test that they're talking about is a test for two blood proteins that are released when you have a traumatic brain injury. And the studies have shown that it's good for looking at lesions in the brain, so things that you may be able to see on CT, or bleeding in or around the brain. Now, when we want to test that diagnosis concussion, what I think of, and what I think most people think of when they read those headlines, is there's a blood test that if the blood test is positive, that means I have a concussion. If the blood test is negative, that means that I don't have a concussion. When in fact, that's not really what the test is doing. The test is good for saying whether or not you may need a CT because you may have something more severe than concussion, but many people with mild traumatic brain injury will test negative on that blood test. So it's a useful test, much like CT and imaging, and in the future, I'm hopeful that we have a blood test that's useful for saying, yes, this is concussion, but we have to be a little bit careful about diagnosis. So then, how do we diagnose concussion? Well, we've already talked a little bit about the different realms that we can see symptoms in, right? Cognitive realms, behavioral or mood realms, the vestibular realm. So there's multiple different facets. And our job is to try to get objective evidence, right? That's the point of trying to have a blood test, is to try to get objective evidence of a disease process that is largely subjective, meaning the patient experiences it, but it's hard to see when you're looking at them, right? So you can't see a headache when someone has a headache. So we have multiple tools. One that we use in our concussion center is a symptom severity score. So we have patients go through each individual symptom that they're experiencing, rated on a scale of 0 to 6, which gives us an objective number that can help us say, okay, this is how severe the symptoms are that they're experiencing, which is helpful in diagnosis. It's also helpful in recovery. So the first step to recovery is having the right diagnosis, right? So once you have the right diagnosis with objective data, we can then track that objective data to make sure that it's getting better over time. And eventually this symptom score gets to 0 when they've fully recovered. We have a couple of other objective tests that we can do. The two that I'm showing up here are just examples. There are other forms of testing. The impact test you already heard of from Dr. Cardenas, so we can do neurocognitive testing. This is basically a computer test that puts people through certain tests of their ability to think and concentrate and compares them to people who don't have a concussion. We have normative data, right? So people who have a concussion, which is a functional brain injury, reliably do worse on this test. It tests your verbal memory, your visual memory, your reaction time, amongst others, and it shows that those in one or more of those realms is worse in people that have concussion and better in people who don't have concussion. And as people get better from their concussion, those scores reliably improve to the normal realm. Now, it's not perfect, right? Everybody's a little bit different, so the range of that normal data is fairly wide. So as, again, Dr. Cardenas mentioned, we like to do baseline testing. So you take the test before you have a head injury. That way, when you have a head injury, we can compare you to yourself as opposed to comparing you to other people your same age, okay? So it gives us a little bit more information. This tool is useful in diagnosis, but again, it's not a diagnostic tool, meaning that this test alone can't diagnose concussion. It has to be along with typical symptoms and injury. The other test that was up there is a balance test. So again, this specific test that's being demonstrated is called a COBALT test, concussion balance test. It's one that our clinic came up with. The person that is up there is one of our athletic trainers, and she's standing on a force plate, and we put her through specific movements, and the force plate measures her sway, right? So how much she goes from side to side, or if she has to correct herself. And reliably, much like the impact test, people who don't have a concussion do well on this test. People who do have a concussion reliably don't do as well, right? Because a lot of balance symptoms with concussion typically. So again, we can do baseline testing. So we can test people before the season, then test their balance after a concussion, and that helps determine, one, whether this looks like concussion, and two, maybe they would benefit from some physical therapy to specifically work on balance and dizziness issues that they're suffering from. So again, a tool to help in the diagnosis of concussion, but not a tool that can be used alone to diagnose concussion. And kind of like I mentioned before, many reasons to make sure that we have the diagnosis right. One, to ensure there's not a more severe brain injury, right? So that's kind of where that blood test comes in. It's where imaging comes in to make sure there's not bleeding in or around the brain, etc. Two, to prevent dangerous things like second impact syndrome. I think most of you have probably heard of that when you have successive injuries, one right after the other, that could potentially even result in death. There are case reports of that. So we want to make sure that we diagnose the first one so that they don't have a chance to have the second one. This is especially true in sport when we're deciding whether they go back to play or when they return to play. It's also important to diagnose correctly so that we can, again, prevent prolonged recovery, so that patients aren't struggling with these symptoms for a really long time, that we can identify them up front, say that this is due to concussion, and then treat them appropriately. And finally, to assist with recovery. Like we said, concussion is a temporary functional disturbance, so it will eventually get better, but there are therapies and other things that we can do to help assist with the recovery of the disease process that, like I said, many people can't see. So a lot of people are suffering from symptoms that other people aren't seeing. So this can help validate the fact that yes, this is an injury and this is how we can help you get better. In the future, I'm hopeful that, yeah, maybe we will have a brain or a blood test or even an EEG that can say, yes, this looks exactly like concussion and that's what that is. But right now, we're just not there. It takes a little bit more information gathering and assessment based on what the patient's experiencing, what their injury was, as well as some of the information from these tools. Thank you.